The burden of ischemic heart disease is rising more rapidly among women in India than in men. According to the Global Burden of Disease Study, IHD was responsible for 1.54 million deaths in India in 2017, of which 6,20,000 were women. This trend highlights a growing gender disparity in cardiovascular health outcomes. Women in India frequently face challenges in receiving timely and accurate diagnosis and treatment for IHD. Factors such as atypical symptoms, limited awareness, and gender biases in healthcare contribute to underdiagnosis and undertreatment, putting women at greater risk of adverse outcomes. This webinar today, we are organizing on a very critical topic: Her Heart Matters, Understanding Angina and Coronary Artery Disease in Women, explores the pressing need for improved recognition, timely diagnosis, management, and strategies to close these critical gaps in women's heart health. We are pleased to be joined today by leading experts. We have Dr. Jyotirmoy Paul, President, Association of Physicians of India; Dr. Agam Vora, Honorable General Secretary, Association of Physicians of India; Dr. G.S. Wanda, Chief Cardiologist at Hero DMC Heart Institute and Vice Principal of Dayanand Medical College and Hospital, Ludhiana; Dr. Sarita Rao, Director, Cath Lab and Senior Interventional Cardiologist at Apollo Hospital, Indore; Dr. Rohita Shetty, Medical Affairs at Abbott, India. So before we begin the panel, let me invite Dr. Pal and Dr. Ora for the President and the General Secretary of API for a short address on today's topic. Over to you both, Dr. Pal and Dr. Ora.
So on behalf of Association of Physicians of India, on behalf of my President, Dr. Jyotirmoy Pal, Dr. Wanda is here, and of course, everybody. I welcome you all to this fantastic meet, and we are going to be talking about angina, as I'm told, and catching them early is what is the theme. We wish that we spread the message across, where we stimulate our colleagues, and through them we stimulate society about creating awareness of angina. If we pick up the symptoms early, if we diagnose them early, I'm sure we can bring a big change in their life. With those words, I wish this program all the best. I wish you all clear as many doubts as you have. And I promise that I'm not going to let Dr. Wanda leave the platform till all your queries are answered. Thank you very much. Over to you.
During independence in 1947, 2/3 of the death was due to the communicable diseases and 1/3 of the death was due to the non-communicable diseases. But in the next 75 years, there is a massive changes in the lifestyle, economic condition of the people. There is massive industrialization, urbanization. So in this century, what we observe that 2/3 of the deaths are due to the non-communicable diseases and 1/3 of the death due to the communicable diseases. Among the non-communicable disease, major portions are due to the cardiovascular deaths, apart from malignancy, trauma, and others. What happens in this 75 years? There is an increased prevalence of the diabetes, hypertension, dyslipidemia, obesity, and all the metabolic diseases. As a result, the incidence of cardiovascular diseases and its complication has increases. Early detection of the angina is very important in India because we can prevent the person from developing the acute myocardial infarction and complication out of it. And what happens in our country, there is a misconception is going on, not only among the population, also among some of the doctors also. So frequently chest pain is misdiagnosed as a acid peptic ulcer disorder, and instead of going to the doctors, even forget about the cardiologist or super specialist center, even then go for the primary health center where the doctors can take the minimum history and do a ECG. If we can detect the angina at the earliest from the symptomology, because on examination most of the findings will be normal, from the symptomology, if we can detect that this person is probably suffering from angina, and we can do the minimum investigation and we can give the appropriate treatment, if required the intervention, we can save the heart muscle.
Thanks, Dr. Vora, for those opening remarks, and Dr. Pal. They have set the stage perfectly for today's important discussion. So let's now move to a panel of experts to discuss the critical topic, which I already introduced, her heart matters, understanding angina and coronary artery disease in women. So let me go first to Dr. Vora. Dr. Vora, why is it important to raise awareness around angina, and what steps are being taken to manage it effectively? Over to you, Doctor.
Angina. Angina is chest pain. Angina is breathlessness. Angina is feeling uncomfortable. Angina is not only seen in elderly. Angina is not only seen in patients with hypertension. Angina is not only seen in patients with diabetes. So when I was a student, I was of the belief that heart disease to khali unko hota hai, who've got a lot of risk factors. You have to be obese, you have to be hypertensive, you have to be diabetic for you to get chest pain, for you to get breathlessness, and angina was ignored. Even today, when I see my colleagues ignoring angina, ignoring this chest pain, I feel something needs to be done about it. And API took this initiative under the able leadership of Dr. Jyotirmay Pal and Dr. Wanda, who's here, that we have decided to create this wave, this movement. With that, I want to convey that this chest pain not to be taken lightly, this breathlessness not to be taken lightly, this uneasiness not to be taken lightly. All you need to do is take a detailed history and get minimum tests done. At least get ECG done. And now with this available technology, you can get help if you're not confident enough to interpret that ECG. If you're not too confident enough to interpret those results that you've done, you can take help of so many newer technologies available and get answer in no time. So that's the whole idea. I wish everybody takes these symptoms little more seriously, pick up those angina, even if it is younger patients, because I'm sure everybody who's present here have witnessed that angina, the heart disease age, is getting shifted by at least a decade. I would not consider heart disease 40 or 50 years ago, maybe 10 years earlier. Today, I'm seeing it in 20 and 25 years old. So this is the time we need to change our thinking. Thank you.
Thanks a lot, Dr. Vora. You've set the stage perfectly once again. So let me quickly go to Dr. Wanda. Dr. Wanda, what should people know about angina first? And could you talk about how common it is, and what are the various risk factors attached to it? Over to you, Dr.
Angina is actually a symptom of heart disease. In its full form, doctors call it as angina pectoris. The basic disease underlying which is causing this symptom is coronary artery disease or ischemic heart disease. People must have read. This disease can present in multiple ways. And angina pectoris is the commonest way actually in which coronary artery disease or ischemic heart disease presents. In fact, we as doctors always say that those who get angina, those who have this disease, are rather lucky because 60 to 65% of people present with angina, but about 30% people are not so lucky. They first time get a heart attack, what we call as myocardial infarction. So they do not really have preceding symptoms of angina, and they first time are inflicted with a heart attack. Even worse are those about 7 to 8% of people out of 100 who first time get actually sudden death only. You must have heard that someone was going on a walk or was sitting in the office and suddenly died. Almost all of those deaths are due to coronary artery disease or ischemic heart disease. Basic underlying process is a deposition of fat in the coronary arteries. Besides this, I would say still more fortunate than people who have angina are those who get their health checkups done. And at an asymptomatic state, they get their investigations, non-invasive investigations like a treadmill test or a myocardial perfusion imaging or a stress echo. These are some tests which can diagnose And in executive checkups, most hospitals do these tests to pick up this disease, especially amongst those who are harboring risk factors. As you asked, there are about 8 risk factors which are causing coronary artery disease or ischemic heart disease, and consequently causes angina also. Now, what angina is basically when someone goes for a walk or exerts, there is a pressure, there is a heaviness, there is a constriction in the mid chest. And we always teach our students also, whenever this constriction is not localized, it is diffuse over the chest, that is actually a typical symptom of angina. Pain which can be localized to one area, say inframammary area or something, is much less frequently due to angina. The sad part is that angina is at times accompanied by symptoms of burping and symptoms of eructations, which at times people attribute to acidity, and then they do not actually seek medical advice, as Dr. Agam Vora was just saying. So awareness of people that this particular symptom comes on exertion and is relieved on rest, is not localized, lasts for 3 to 5 minutes, can go to the left arm. There can be sometimes some people have their shoulders are kind of heavy shoulders they have, especially when they go for a walk. And those who have these risk factors, now the commonest risk factor is high blood pressure, as Dr. Agam said. The second important risk factor is diabetes. Third important risk factor is obesity. Fourth is actually lack of exercise. Fifth is stress. And sixth and seventh very important risk factors are positive family history. Some people are genetically prone to this particular disease. And those individuals who have in their families people less than 60 years getting afflicted with this disease, they have a genetic makeup which is actually because of which they get more prone to this particular disease. So you can almost say that these are people who are at a greater risk. Seventh is use of tobacco, whether it is tobacco chewing, whether it is smoking. Tobacco is the commonest risk factor. Dr. Agam Vora was talking of coronary artery disease amongst young people, men and or women. Younger people, when they get afflicted, tobacco is one of young heart attacks. Tobacco is the most important factor. And obesity, of course. You can actually say obese people are more at risk of having coronary artery. So, but the correlation is not as simplistic as Dr. Agam Vora was saying. Some people can have this disease and they may not have any risk factors. So we do have people who have a genetic predilection. They may not be obese, they may not be smoking, they may not have high blood pressure, diabetes, obesity, fat intake may not be there. It is said, coming to the topic for today, in women with diabetes, actually women before menopause, because of the hormones, there is some benefit that they have. This coronary artery disease is relatively less than men. But this advantage is lost when you have a diabetic woman. So diabetic women, especially because they will have atypical symptoms, in them these symptoms should be looked at, and one should. So if someone has risk factors, has these symptoms as that we have just spoken of, that is what angina pectoris, that is where you will diagnose it.
Thanks a lot, Dr. Wanda. I'll come back again. Let me quickly go to Dr. Sarita Rao. Dr. Sarita, we heard from Dr. Wanda, and he was talking about women and atypical symptoms in women. So, Dr. Rao, I want to ask, how does heart disease present differently in men and women? If you can explain that, it would be really informative for people who are looking into this webinar. Over to you, Dr.
Thank you, Pratibha. And when we talk about heart disease in women, you see, premenopause, as we've just been discussing, women do have a certain amount of protection because of their hormonal status. But post-menopause, the incidence, the prevalence is the same. And that's important because it has been touted widely that heart disease is a man's disease. It's not. That's a myth. The truth is that women and men are both affected by heart disease. The problem is the diagnosis in women is poorer. And why is that? Because women present with different kind of symptoms. The symptomatology in a woman would not be the classical chest pain all the time. They may have pain, but this pain may be diffuse. It may be difficult to for them to say that they're having a typical heaviness or a typical crushing pain. So they do have pain, but it's different. And the pain can be anywhere between the level of the diaphragm to the jaw, but they present with symptoms like a feeling of something not being right, sometimes just perspiration, or sometimes they'll complain of just breathlessness. Especially the diabetics, they complain a lot of breathlessness, of sweating, of acidity, of heartburn, of nausea, a sensation of vomiting. So women have different kind of symptomatology, which makes it difficult to say that pick it up and make a diagnosis immediately that, oh, do they have heart disease? The second thing is that when you do the test for women, a lot of women would have baseline ECG STT changes. And in many women, that's sometimes normal. So when a woman comes in and she has minor STT changes on her ECG, it's not taken so seriously. At the same time, when you send them for a treadmill test, there's more incidence of false positive treadmill tests in women, which is why, again, it's not taken seriously. The third thing is when these women patients have angiograms, and the angiogram doesn't show up any kind of a blockage, an obstructive CAD in the epicardial arteries, they're dismissed that they do not have angina. We forget that women have a lot more incidence of microvascular angina, and that's not visible on a typical coronary angiogram. So microvascular angina also needs to be kept in mind. At the same time, even if a woman does have heart disease, it's been seen, the data shows that she presents more than 12 hours after the acute episode to the emergency. So delay in diagnosis, delay in presentation to the emergency room, delay in receiving treatment. Now, why exactly? Because the symptoms are atypical, because women are not so economically independent, and many a times they also put themselves last. So there are a lot of things when we talk about heart disease in a woman, it's different in many ways from men, right from the symptomatology to the diagnosis to receiving treatment. Also, if you look at the treatment protocols for men and women, because most of the people included in the trials were men, the average rate of representation of women in the clinical trials is about 20%. So while we extrapolate treatment which works for a man as treatment which works for a woman, we may not always be right. We're not really 100% sure that it would work in a woman. So angina in women, chest pain in women, CAD in women is different. Also, women have a whole host of different risk factors. For example, physiologically, if you look at it, a woman undergoes pregnancy and childbirth. So if a woman develops gestational hypertension or gestational diabetes, she's at higher risk for developing coronary artery disease. If a woman develops an early menopause, she's at higher risk for developing heart disease in the future. Again, a woman with PCOD, a woman with autoimmune diseases, which are so much more prevalent in women, would have more chances of developing heart disease in the future. And these are things which need to be looked at in a totality. So that's how it's different. And I'm very happy that today you're focusing on a fact that her heart matters. You see, half the population is women, and her heart really does matter.
Yeah, you put that very nicely, Dr. Sarita. I think women heart is more complex than anything, So let me go to Dr. Wanda. Dr. Wanda, how do women typically experience angina symptoms? Though we have discussed this, if you have more things to say, and how might they differ from traditional expectations? Over to you, Dr.
See, as we discussed, premenopausal women have less coronary artery disease. So this particular information actually has been overemphasized. And partly this is one reason for complacency. Women at times feel, even the families feel that they will not have coronary artery disease at a younger age. Whereas now with the changing lifestyles and women imbibing the same social responsibilities and work-life balance is lost. They try to multitask in many things. In many ways, women are in fact under greater stress than men also, who only have to do particular tasks only. So women do get coronary disease, their lifestyles are changing, their prevalence of diabetes is higher. And as Dr. Sarita Rao said, their symptoms are a bit different from men. They more often have atypical symptoms. But generally speaking, the symptom of angina that we are talking of, or myocardial infarction, heart attack, they are not very different in women and men. They still will have those symptoms when they will walk, they will have heaviness. And if you dig into the symptoms, you will be able to get that when they take rest, that symptom disappears. As Sarita said, ECG changes can be non-specific. TMTs are a little bit less informative in women, but provided your doctor has this information and interprets the results in that, what I think the purpose of your this particular session that we really want to emphasize to the masses is that yes, the symptoms are a bit atypical. The disease is little bit less in pre-menopausal as men, but still the disease is fairly prevalent. And urban women actually have more coronary disease than rural women. And the prevalence of angina in the general population is about 5 to 8%. In fact, Indians have one of the highest prevalence of coronary artery disease in the world, actually, because we have a genetic predilection, the thrifty gene that we have, the syndrome X, the metabolic syndrome, the central obesity, insulin resistance. So because of some lipid fractions like small lipids, LPA levels are higher amongst us. HDL levels are low, triglycerides are higher. So we as a race are actually having more coronary disease than the Caucasians or the Westerns or Chinese or Japanese. And for this reason, actually, this whole information has come from the West. Though, Indians migrate a lot, and the Indian diaspora, it's been seen that the racially Indians, or rather the South Asians, Sri Lankans and even the Pakistanis, all of us, we are afflicted with heart attacks about 10 years earlier than the natives of those populations, whether you talk of Singapore, you talk of Canada, US. In fact, in US now, very many studies are going on looking at the higher prevalence of Indians as actually South Asians racially. It is one of the area of interest all over the world. So coming back to your emphasis, these symptoms should not be ignored, and anybody having symptoms linked with exercise, those are at least symptoms which should never be ignored. One should not actually feel that burping or some eructations, if they are there and they are giving relief. In fact, that's how angina does get relief very often. ECG as a test is not a very good test. It can give you complacency, because ECG, unless it is done during pain, it will not diagnose. So a stress test or an exercise test or a stress myocardial perfusion, some sort of an investigation will have to be done. Those women who have more risk factors, those who have diabetes, high blood pressure, those who smoke, those who have family members, those kind of, they should really be watchful and careful, because the disease happens to be more amongst them.
Okay, thanks, Dr. Wonder. Going back to Dr. Sarita. Dr. Sarita, you want to add more points? I think it was an elaborate, answer given by Dr. Wonder. You have any points to be added, or if you can talk about what are the traditional and emerging risk factors for angina in women across different stages of reproductive life? Specifically, if you talk about the reproductive life, yeah.
That's a good question, Pratibha, and I'm fully concurrent with the views of Dr. Wonder. And when we talk about, the traditional risk factors, and then we talk about emerging risk factors. So traditional risk factors we've been discussing, and the traditional risk factors such as hypertension, diabetes, dyslipidemia, that means elevated cholesterol levels, particularly the LDL, which we're looking at. Then we're looking at obesity, we're looking at physical inactivity. We are also looking at smoking, we excessive alcohol, and a bad diet. So all of these, traditional risk factors which you're looking at is typically there in men and women both. But when you talk about emerging risk factors in women, the story of a woman actually begins intrauterine. And when you talk about a child in the mother's womb, if the mother suffers from malnutrition, then it affects the child too. And that in itself is a risk factor for future CAD. And when this child comes up into the adolescence, and if the child develops something like a PCOD, then again, it's a risk factor. Then the child comes into the reproductive phase, which you were referring to, Pratibha. And in the reproductive phase, when a woman gets pregnant, that's the time she develops things like gestational hypertension, gestational diabetes. And these are all harbinger of increased risk for future coronary artery disease. And typically what happens is that once we call pregnancy as a window of opportunity, if it is taken well. Now, the window of opportunity is because the woman always goes to a doctor at that time, and the diabetes and the hypertension is picked up. But what happens once she delivers, people automatically assume that this diabetes and hypertension will go away because the pregnancy is over. Many a time it doesn't. And many a time it blooms into a full-blown hypertension and diabetes, which remains untreated and a harbinger of future events. Again, if women are also susceptible to more autoimmune diseases, again, a risk factor for future CAD events. And then the woman after pregnancy goes into menopause. And if the woman has an early menopause, again, that is a risk factor for developing future CAD events. And menopause in itself is a transition because after menopause, the incidence of heart disease in women would go up as compared to prior. So there's a lot of risk factors in women all through her course of her life. And also an important thing is a lot of women take hormonal contraceptives, and that itself would predispose to thrombosis many a time. So there's a lot of things which happens in a woman's life which she needs to be aware about and take appropriate steps to take care of her health.
Okay, let me go to Dr. Wander. Dr. Wander, if you can also touch upon the reproductive health factor here. How do you see, is there any risk factors apart from what Dr. Sarita Rao has seen? And also if you can just give us any percentage, like you have spoken about urban and rural divide, right? In reproductive health, have you seen any case studies or anything interesting which you want to share?
As we have emphasized before also, actually, women's life cycle is not the same as men's. And as Sarita said, they use oral contraceptives, they go through pregnancies. And what she was emphasizing was that very early people who are having a greater predilection for this disease can be picked up. Those women who have gestational diabetes, which means that they have diabetes during pregnancy, or those who have high blood pressure during pregnancy, they are normally kept under closer follow-up because they are likely to develop diabetes and hypertension subsequently, and they have heart disease more often. So this is another marker actually. What is pregnancy? It is just an increased stress actually. So if stress is increasing the prevalence of diabetes or hypertension, it means that they have a predilection for these diseases, and in later life, these are more often seen in these women than in those who do not have it. So you will be able to diagnose this disease earlier if you keep these women, you put them on a lifestyle modification a little bit more diligently, just as you would put a woman who has a family history of coronary disease or an obese lady or a hypertensive lady. So these are the women in whom you will be more watchful that they do not develop coronary artery disease earlier. So this is actually a marker. And as we said, post-menopausal actually coronary disease is similar in men and women. Coming to your issue of, see, earlier we had a greater rural and urban divide. Now there is a convergence of risk factors, whether you talk of high blood pressure, diabetes, which are the common risk factors for heart disease, These are all actually, as urbanization is happening in rural areas, at least in some states, like in my state, urbanization is actually so common amongst rural areas. The rural people are catching up with the urban lifestyles, just as we say that women are catching up with the men's lifestyle. So as there is more of balance happening, the disease is coming up more in rural areas also. But generally speaking, the urban individuals have almost two times the disease as compared to rural individuals, because almost 50% of coronary artery disease is your genetic predilection, but almost half is in your hands actually. How you spend your life. If you are not eating fats, you take a regular exercise, you take a fat-free diet, you manage your stress properly. If you are hypertensive, you get your blood pressure controlled. If you're a diabetic, if you can control your sugar, you do not have obesity. If you have dyslipidemia, you start lipid lowering agents. So if one is careful, the disease can be prevented or certainly delayed. So for that reason, actually, that's why we emphasize on health checkups also. Now, as women are becoming executives and taking positions which are very responsible positions in the society, they still have to manage their houses. They have to go through these, as I said, stress of pregnancy and those hormonal changes that happen. So the prevalence of coronary artery disease is increasing amongst women over a period of time. And that's the whole purpose of this exercise, what we are all doing actually, to make the general public aware and to dispel this feeling amongst people that coronary disease is not a disease of men. It is almost similar in men and women. With changing lifestyle, women are getting more actually susceptible to coronary disease, and they should also seek medical advice early if they have any of these symptoms.
Thanks a lot, Dr. Wonder. We are pushing for gender equality, but the disease is getting gender neutral. So, again, I have a question to you, Dr. Wonder. What actions should be taken when someone experiences angina? What key symptoms should not be ignored? Over to you.
Yeah, that's a lovely question actually, because that's the whole purpose of this exercise. Besides the risk factors, which we have actually enumerated so many times, because these are very important factors. Now, those who have more of these risk factors are more likely to have the disease. And as we said, symptoms should not never be actually ignored. More so, we are talking of angina, but more so symptoms of heart attack. If someone has a severe excruciating pain in the chest, and it is going to the arms, someone is sweating along with that, it is very important to suspect heart attack, because those people who are taken to the nearest hospital within 6 hours, we say 12 hours because that's the window for intervention, but ideally within 6 hours, those people with these sort of severe chest pain symptoms, if they can be taken to the nearest hospital as early as possible, and a simple ECG during pain is very, very valuable. So if a ECG is done at that time, and the ECG will show changes always during pain. The purpose of this session that we are having is, one biggest purpose is that people should not ignore acute severe pain. Go to the nearest GP, go to the nearest facility where a ECG is available. You can go to the best of hospitals, but if you have wasted 12 hours, nobody will be able to do much for you. You can go to the most elementary and basic hospital, but if you have reached within 1 hour of the chest pain, so that is the importance of going to the nearest hospital as early as possible. If there is acute severe chest pain with sweating, with burping, with vomiting, take the person to the hospital. 50% of the deaths due to heart attack occur before these people reach hospital. So that time should not be lost actually.
Okay. Dr. Sarita, you have anything to add on this question? Anything to add on the key symptoms that should not be ignored?
So it's very important, especially today we're talking about her heart. So what I want to say is women, and because they have a little different symptomatology and they take themselves not so seriously and tend to put everybody first. And we've been talking about this, that women multitask today. What has happened is that a woman has come out of her home and taken the role of provider also, but she's still the mother, she's still the wife, and she's still the daughter and the daughter-in-law. So multitasking, levels of stress, and level of being made to perform on every level is high. I think all of you can correlate with that. The message here is that if you are having these symptoms of uneasiness, of chest heaviness, of pain in the chest, of breathing difficulty, of unnecessary sweating, dizziness, take it seriously. Rush to the nearest hospital, the nearest doctor, the nearest nursing home which you have. And near is important because time is muscle. The nearest place that you will get there, they will give you the antiplatelet, they will thrombolyze. It doesn't matter if it's not the best tertiary care in the city. So get to the nearest hospital, get your ECG done. Most of the time, just the ECG in 90% of the cases is enough to give us the diagnosis. You will receive the primary care treatment. Take yourself seriously. Take your heart seriously. Get that checkup, which you've always been thinking about, but you've always delayed. And when you have symptoms, get to the doctor fast, because that's the only thing which is going to save your myocardium, your heart muscle, and you.
Thanks, Dr. Sarita. That is very important. We always push everything, else, not the health. So let me bring in Dr. Rohita, who's been patiently listening to us. Dr. Rohita, I would like to ask, could you share how Abbott is contributing to raising awareness around coronary artery disease and angina? Over to you.
Thank you, Dr. Sarita. That was helpful. So we heard from our experts, and it was really an enriching conversation to listen to. So Pratibha, responding to your question, I'll take it in two parts. I'll tell you something about from a global perspective and something about India perspective. So as a part of our global 2030 sustainability goals at Abbott, we are focused on tackling the non-communicable diseases like diabetes and cardiovascular disease. So our efforts, they include advancing the minimally invasive procedures, the cutting edge technologies which will help to detect and help in better treatment. At the same time, even expanding access to educational resources and awareness initiatives. That is to support individuals in getting better management and having an early diagnosis of any kind of cardiac diseases. But when I talk about India, our comprehensive diabetic and cardiac portfolio, they help to address the patient needs. When I say that, that's identifying angina, helping in early detection of this condition to have better management. And for this, we developed three critical tools, very unique tools. First is something we call as the OPTA checklist. Second, an OPTA questionnaire. And third, an OPTA approach. This is to support the diagnosis, prognosis, and medical management. So these tools were launched in 2024 with utmost support and endorsement from the Association of Physicians of India, and with the sole intent of helping the healthcare professionals in timely diagnosis, and thus which would benefit the patients at large to lead better lives. Thank you, Pratibha.
Thanks, Dr. Rohita. That's a nice initiative. We would need such tools which helps us to make things easier. So let me go back to Dr. Wander. Dr. Wander, you've been like both Dr. Wander and Dr. Sarita have been talking about lifestyle factors and how it's impacting. It's very difficult if you don't have two or three spoons of sugar in your coffee or tea to take that stress buster from it's a stress buster. So can you explain how lifestyle factors and stress contribute to coronary artery disease and angina? What key lifestyle modification can help prevent these conditions, and how important is stress management for heart health? Dr. Wanda.
Stress is one of the key risk factors for coronary artery disease. And as we said, lifestyles are changing. Type A personality is well known actually to be one of the causative risk factors. Type A personality is nothing but people who are over ambitious, who are aggressive. In fact, it's not the amount of work which is said to make to correlate with coronary disease or atherosclerotic disease. It is actually the conflict or anger or time mismanagement which makes actually a bigger difference in terms. So in that sense, people who have type A personality, they have greater risk of coronary disease than type B. It's also been shown medically that you can change the personality of a person. Earlier, people used to believe that what you are, you will remain. But through yoga, meditation, exercise, physical exercise, as you said, is actually possibly the best stress buster that you have. Having hobbies, singing, gardening, all these things actually, good, strong family backup, people who have friends. So all these things are responsible, and they actually people are losing in the present day world. So stress is, besides very good diet management, that you cut down on the fat intake that we do. And now we know that for Indians, we are very high carb eaters actually. So we derive a much higher number of our calories from carbohydrates. And the thin fat Indians that we are, the visceral fat is more amongst Indians as compared to any other races. So as you said, sweets and sugar, all these things will have to be reduced. Besides, for high blood pressure, we know salt is in fact a causative factor for high blood pressure. So decreased salt intake is important. Physical exercise not only relieves your stress, it reduces your weight, it reduces your blood pressure, it controls sugar better. So innumerable benefits of aerobic exercise that people, not the kind of exercise that you do in the gyms or in a charged atmosphere, but the exercise that the outdoor exercises that we actually advertise. So as we have said, diet, exercise programs, stress management, weight control, or regular health checkup, all these things will help to reduce the risk of coronary artery disease.
Thanks a lot, Dr. Wonder. One more question. I will come to Dr. Sarita with the same question. But Dr. Wonder, you think since young people are also getting a lot of heart attacks nowadays, so any kind of a age limit you think that they should start early these exercises and everything? It is not that you hit 40 or then only you would start. Any age limit?
Yeah, that's a very good actually point to discuss, because adolescent obesity, adolescent high blood pressure is getting more and more common, because obesity is much more. We did a study in Ludhiana actually in our institute. 20 years back, we looked at some schools in Ludhiana, and we found that the prevalence of obesity was about 6%, and the prevalence of high blood pressure was 3 to 4%. More recently, we went back to the same schools, obviously not the same people, but what we found in the same age group, the prevalence of obesity has doubled, and the prevalence of high blood pressure has also doubled from 4% to 7 to 8%, and obesity from 6 to 12%. So obesity is increasing, lifestyles are changing. Something like mobile phones and all were non-existent earlier. So what is these kitchens which have community kitchens which are coming up? People are not no longer cooking at home, and you know the way frying oxidized cholesterol is increased when you keep frying the same oil again and again. So the changing lifestyle is going to have a huge bearing. And in fact, it's been seen that while in other communities in the Western societies, the coronary disease incidence is decreasing, in South Asians, it is going up. So unless we adopt these preventive measures in a large proportion, we already have a genetic predisposition to this disease because of Sarita dwelled upon this, the thrifty gene, small for date children that we preterms, and the preterm incidence is much higher amongst Indians than other communities. Small weight children is higher. Central obesity is higher. So we have a predilection for this disease, males and females, both of us. And unless we adopt all these lifestyle measures, this disease will afflict more and more people in the coming years.
Thanks a lot, Dr. Wonder. Dr. Sarita, your pointers like how to manage stress for heart health, especially if you can take up the women point of view.
So, how to manage stress? Now, stress in itself, the levels are high in women. Now, stress and also a lot of stress-related issues. For example, pregnancy is a very stressful period, and a lot of women develop postpartum blues. And that's anxiety, that's depression, that's a lot of mental health issues at that time. And stress is also when you're struggling to develop your career and at the same time you have small children. What I always say to everybody is that we have to learn how to deal with stress. And dealing with stress means allocating a certain amount of time every single day to me time. And that me time has to be utilized in doing something that you like to do. If it's yoga, then by all means do it. Because you need to do something both for your physical and your mental health. If you like singing, you like gardening, you like walking, you like dancing, please by all means do it. It's also important, along with the physical activity, to get your dose of mental health every single day. And that me time is very important. And juggling between home, work, family, every time you take that 1 hour of me time, you tend to feel guilty. And it's important that we don't feel guilty about that, because if only you're healthy, are you going to be able to keep the rest of your family healthy? Now, while we're talking, so finding ways to combat stress is what suits you in your lifestyle the best, and also what you like. For example, if you're walking, make sure that you have a walking partner. It makes you tend to stick to it all the time and not take holidays from walking. So that's important in dealing with stress. Proteins, sprouts, all of these things, very good for your heart. So focus on your diet, because focusing on your diet also means a lot to your heart health. At the same time, high levels of stress also means increase in the amount of smoking in women and men both. So smoking kills is true, because a person who smokes or chews tobacco, for a man, it's twice the risk of CAD. For a woman, it's 3 times the risk of heart disease. So absolutely say no to smoking, say no to alcohol, because again, alcohol will increase your blood pressure, and that would in turn increase your risk of heart disease. Also, when we're talking about managing stress and physical activity, it's very important, because in today's world of urbanization, every child, especially post-COVID, is having a mobile phone in their hand, an iPad at home, a laptop at home, and a TV screen in almost every room in the house. There's nobody. The playgrounds are empty. Children don't go to play. Elders don't go to walk. What is this society that we are building up for ourselves? And all of it is translating into increased coronary artery disease, which we already have a huge predilection for. Because if you look at the Indian population, we get coronary artery disease 10 years earlier. And when we get it, it's more aggressive, it's more diffuse, it's more malignant, and the chances that it be triple vessel disease are much higher. So physical activity, diet, stress, obesity, alcohol, smoking, all of these things, this lifestyle which we have been building up for ourselves, it's killing us. So it's time we wake up, take control of the situation before it hits us harder.
Yeah. Dr. Sarita, how critical are regular checkups for screening for both men and women who might be at risk of angina? What would be the duration, if you can specifically talk about that?
So typically, it's very important to go in for your preventive health checkup, because the best time that you can heal your body is now. And we always say that after the age of 20 years, everybody should get an annual health checkup. And if you look, most of the corporates, most of the companies have this policy that the employees must have an annual health checkup. So most of the working men and working women do get an annual health checkup, and it's very subsidized rates. So you get a host of blood tests done, which also includes your lipid profile. You do get a treadmill test, you do get an echocardiogram, you do get an ultrasound of the abdomen, you get a pap smear, and you get a routine breast screening also, which typically covers a lot of the things which can happen and remain undiagnosed in people. What we also need to focus on is that while all the working individuals do get their annual health checkup, in India, we also have a large burden of women who are not working. And for every person who's out there listening, make sure that you get the ladies in your house also to undergo these preventive health checkups, which, by the way, are very easily available and at very subsidized rates. Because picking up a disease, picking up angina in a patient before the patient has had a heart attack is very important because it prevents the burden of LV dysfunction. Once a patient has had a heart attack or a myocardial infarction, as we call it, the ejection fraction of the patient will be permanently impaired, right? So the burden of LV dysfunction is huge. So it's important to catch these diseases right at the time that they start and to fix them so that life can go on in the same way and we can make some lifestyle changes and make it better.
Thanks a lot, Dr. Savita. Let me go to Dr. Rohita. Dr. Rohita, could you please share more details about Abbott's initiative? You have an initiative of Angina Awareness Week, which you have launched last year. So, what motivated this initiative, and what activities are planned for this year to raise awareness about angina?
Thank you for the question, Pratibha. So, awareness around angina, as our experts have clearly articulated, is very limited in our country. So there are many individuals, especially women, who are unaware about the symptomatology and the seriousness of this particular condition. So that's the reason it's of paramount importance to enhance public understanding. And there are certain population, especially women, who need to be taking their heart health very seriously. So to address the critical gap in the understanding, as Dr. Sarita and Dr. Vanda have clearly told all of us, Abbott has partnered with the Association of Physicians of India and have launched the Angina Awareness Week. This was done in 2024. This was an initiative which was done in 2024, started back then, mainly to educate people about the alarming signs and symptoms, the need of early diagnosis and treatment. We started in 2024, but we're not stopping there. In 2025, we have a renewed focus. And this time, we're going to concentrate on women's heart health. So we believe, along with the support of the Association of Physicians of India, that it's time that women need to be empowered. They need to understand better, take charge of their heart health so that they have a better quality of life and live life to the fullest. Thank you, Pratibha.
Thank you, Dr. Rohita. Let me go to the panel again. I would like to start with Dr. Sarita. What message or key takeaway would you like to leave with our audience on how to keep their heart healthy? If you can give us in pointers, 3 important pointers.
So the first point, which I always tell everybody, is know your numbers. When I say know your numbers, it's know what is your blood pressure number, what is your cholesterol number, and what is your sugar number. These 3 numbers will help you know if you have hypertension, diabetes, or you have high cholesterol, which are all risk factors for heart disease. So the first point is know your numbers. Second is make your lifestyle choices wisely. So remember to eat healthy. Remember to exercise daily. Remember to say no to smoking and say no to alcohol. And the third thing I always tell, I'm a woman, I'm partial to women, and I always tell everybody, all the women out there, you matter. And if you matter, it's important that you take yourself seriously, take your symptoms seriously, and make sure that you go there and get your annual heart check done.
Dr. Wander, your pointers, please.
Well, I think we've discussed it in detail, and we have emphasized that coronary artery disease or ischemic heart disease is the commonest non-communicable disease, which is responsible for almost the death of one third of the people. So what we are talking is something very, very common, and no one is immune. Men, women, and now, as we discussed, even younger ages in their 30s, 40s. Earlier, we used to see these people in their 50s and 60s. Now we see them in their 30s and 40s. So the preventive measures, actually, the seeds for this disease are sown pretty early. And the preventive measures, the lifestyle changes that we have discussed in detail, should be actually inculcated in the life of youngsters and then maintained over a lifetime. Second, I would say one should not ignore symptoms. Any symptoms that you have, you seek. One must have this. Somehow, in bigger towns, the habit of having a good GP is getting lost. People must have a good GP to whom they can go and ask and check. They would know about their profile in a better way. And never ignore your symptoms. Go to your nearest doctor. And third, as I emphasized earlier, someone having severe acute chest pain should be taken to the nearest hospital, do an ECG, and that can really prevent these fatalities.
Thanks to each one of our speakers and attendees for joining. It was a very informative session. I mean, I got a lot of pointers. I'm going to go and do my, checkup first. So it was a very interesting session. We hope this discussion sparks greater awareness and action towards improving the heart health for women across India, not just women, everyone. So let's turn today's awareness into action to protect and prioritize women's heart health. Thanks a lot to each one of the speakers for joining in. Thank you so much.